Next, I'm going to start is submandibular region. So in submandibular region, what is the thing is that in submandibular region, there are two salivary glands which are present. One is submandibular gland and sublingual gland. I think parotid we have learned. So next we are going to do the submandibular and sublingual glands. So the submandibular glands is more important, which is also UQ. It is size of a walnut and it is partly superficial and partly deep. It is a mixed type of gland. A large superficial part is there and a small deep part is there, and they both are separated by mylohyoid muscle. Okay, two parts. The superficial part is so large it fills most of the digastric triangle. So most of the digastric triangle is filled by the superficial part of submandibular gland. Now the facial covering it encloses, which we have done in the investing layer of facial, it attaches to the mandible. When it is vertically traced above the hyoid, it splits to enclose this gland, and this encloses and attaches to the mandible. Okay, now the relations of the superficial part. So the relations of the submandibular gland of the superficial part is that over the superficial surface, it is divided into three surfaces: superficial surface, lateral surface, and medial surface. The superficial part, okay, and the deep part is different. So the superficial surface is skin, superficial fascia containing platysma and transverse cervical facial nerve. Then comes deep cervical, deep fascia, and then facial vein. Okay, and then the lateral surface is related to body of mandible, medial pterygoid, and facial artery. What? Body of mandible, medial pterygoid, and facial artery. Body of mandible, medial pterygoid, and facial artery. And then the medial surface, there is anterior part, middle part, and posterior part. Okay, anterior, middle, and posterior. Anteriorly, it is related to mylohyoid muscle, nerves, and vessels. Middle, it is related to hyoglossus and styloglossus. And posteriorly, it is related to glossopharyngeal nerve and styloglossus. Okay, glossopharyngeal nerve and styloglossus. And in the middle, it is related to styloglossus and hyoglossus. In the upper part, it is related to mylohyoid nerves, muscles. Okay. Then the deep part, the small one, it is the small part among the superficial and the deep part, and it lies on the hyoglossus muscle, and it is closely related to the duct of the submandibular gland. Okay. So medially it is related to hyoglossus muscle. Laterally it is related to mylohyoid muscle. Superiorly it is related to lingual nerve, inferior and the submandibular ganglion, and inferiorly it is related to hypoglossal nerve and its venae comitants. Okay, so medially it is related to hyoglossus, laterally it is related to mylohyoid, superiorly it is related to lingual nerve, and inferiorly it is related to hypoglossal. Okay, now submandibular duct, which is also called as Barton's duct, it is 5 cm long. It emerges from the deep part, from the anterior end, near the anterior end, crossed by the lingual nerve. So here the lingual nerve crosses this submandibular gland, and it opens into the summit of sublingual papillae at the side of frenulum of tongue. At the side of frenulum of tongue, it opens into sublingual papillae. Okay, so it opens into the summit of sublingual papillae, at the level of at the right side of frenulum of tongue. It opens into the summit of frenulum of tongue. It opens into the summit of sublingual papillae at the side of frenulum of tongue. Okay, now the blood supply, the arterial supply is by sublingual and submental arteries. Veins is by common facial vein and lingual veins. Common facial vein and lingual veins, sublingual and submental arteries. Sublingual and submental arteries, common facial vein and lingual veins. Then comes the lymphatic drainage. The submandibular lymph nodes, like jugulo-digastric nodes, submandibular lymph nodes drains into jugulo-digastric nodes. Submandibular lymph nodes, it drains into jugulo-digastric nodes. And then comes the nerve supply. There is parasympathetic nerve supply, sympathetic nerve supply, and sensory nerve supply. Okay, then we'll talk about submandibular ganglion. So the parasympathetic nerve supply, from the superior salivatory nucleus, the secretory motor fibers, they reach the facial nerve. From the facial nerve it reaches the lingual nerve, and then it relays in submandibular ganglion. From there preganglionic fibers, postganglion, till here preganglionic fibers are there, then the postganglionic fibers are given to the submandibular and sublingual glands. Okay, superior salivatory nucleus, facial nerve, lingual nerve, and then comes the relay in the submandibular ganglion, and then postganglionic fibers arises and is given to submandibular and sublingual glands. And then comes the sympathetic fibers from the T1 spinal segment, superior cervical ganglion, that is how the sympathetic fibers come. Sensory is by lingual nerve. Okay, now submandibular ganglion is also called Langley's ganglion. Okay, this serves as a relay for parasympathetic supply. Okay, topographically it is related to trigeminal nerve. How it is related to trigeminal nerve? To lingual nerve. So structurally it is related to trigeminal nerve. Lingual nerve is a branch of mandibular nerve, whereas functionally it is related to the facial nerve. How? Through chorda tympani. So lingual nerve is also related, is actually carry along with lingual nerve, chorda tympani fibers are also coming from the facial nerve, which gives special sensations to the tongue. Okay, so what are where are these parasympathetic supply going? These are going to the anterior 2/3 of the tongue. Okay, and then it gives chorda tympani. Okay, because it's functionally related. Thank you.